Eczema or dermatitis, as it is commonly referred to, can be defined as acute or chronic inflammations of the skin. Several forms exist that are results of varying environmental factors or even age-related indicators. One of the most common forms of eczema is referred to as atopic dermatitis, which is present from infancy in the individual. Another common condition is contact dermatitis, which is brought about by the contact of skin with an irritant factor. Eczema of the scalp that results in the formation of dandruff is named seborrheic dermatitis and presents a common household condition. One of the many other forms of eczema presents as the inflammation of skin around the ankles and lower limbs, referred to as stasis dermatitis, which is a common condition addressed by podiatrists. Various symptoms and identifying characteristics associated with eczema aid in isolating a diagnosis from other similar conditions. The most common and well-known symptom of eczema is an itchy nature of the skin. Common issues such as flaking, swelling, rashes appearing, and blisters forming on the infected area are distinguishing factors for eczema presence. Lesions that form on affected areas can potentially build up with fluid and rupture, increasing the susceptibility of further infection. Eczema-related rashes and skin imperfection can take place in various places across the body. However, they are quite common inside of the elbow, behind the knee, the face, and on an individual's hand and feet. Diagnosing the presence of eczema on a patient includes various factors and symptoms that indicate the type of dermatitis or whether it is an unrelated condition. Most commonly, eczema is diagnosed by general practitioners or dermatologists, who require details on the progression of the infection. Family history and historical instances of skin conditions also prove beneficial for the medical professionals to correctly diagnose eczema. As a result of the range of factors that influence the presence and severity of eczema on a patient, it is essential that a thorough historical and clinical assessment is carried out to ensure the most effective course of treatment. In most cases, a general practitioner is capable of making a diagnosis of eczema from a thorough examination of the location and symptoms of the impacted skin. If a greater depth of knowledge is required to determine a diagnosis, the GP can make a referral to a dermatologist for more extensive testing. Often, dermatologists will undertake a patch test to differentiate between skin conditions and identifying a suspected allergen responsible for irritation. A patch test involves applying small patches containing allergens onto the patient's back with hypoallergenic tape. The desired allergen will elicit a response following contact with the skin and allowing the dermatologist to differentiate from other common contact substances. An acute and chronic phase are both usually experienced throughout the course of an eczema infection. Vesicle formation on the surface of the skin is a common result of eczema's acute stage. These have the potential to burst themselves, but the additional itchiness of surrounding skin can lead to the individual scratching and therefore rupturing some vesicles, which can lead to greater pain and infection. These can prevent the skin from healing effectively and allow more pathogens entry into the skin. As the eczema progresses to the chronic phase without proper treatment, these areas of skin are often transformed into dry, scale-like rashes. The dry and itchy nature of this skin limits the ability to pair as a result of the environment not being efficient for growth and the individual being tempted to scratch affected areas. Individuals may also experience a hindered range of motion when eczema presents on joints and areas of the skin that are prone to stretching. Movement in these areas may prove painful from the dry skin cracking, and wound healing will be hindered, requiring longer to repair. Although individual dermatological diagnosis and pathogen susceptibility are major factors in future prognosis for patients, adequate management and prevention techniques can ensure individuals are not hindered by eczema for their entire life. Many individuals will experience bouts of eczema throughout their life as a result of particular allergens, while some may stop experiencing symptoms of dermatitis as they grow older. Current treatment protocols are able to create a regime where symptoms are easily addressed or do not negatively influence a patient's quality of life. Although allergen susceptibility has a major impact on the occurrence of eczema, various personal care procedures can positively influence the healing and experience of an eczema breakout. The daily bathing and skincare routines that an individual completes can contribute to the healing of their condition. It is important to assure that the skin has adequate moisture and is not subject to harsh conditions. Showering at a lukewarm temperature is recommended, as it prevents the dehydration of skin associated with showering at a high temperature. Following a shower, it is beneficial to apply moisturizer to the skin in order to prevent further fluid loss. Topical corticosteroid creams are a common technique for treatment when a case of eczema has already been diagnosed. To improve skin healing, topical corticosteroids are administered on the site of infection and aim to reduce inflammation and irritation. This will prove beneficial in stopping the individual scratching and inhibiting the healing of the skin. These creams can be obtained in a variety of concentrations that range from prescription to over the counter. Medication absorption within the infected areas is heightened through the application of wet wraps. In order for a wet wrap to be administered, the skin must first be bathed in order to clean it, and the prescribed medications will then be applied onto the skin, followed by a wet layer of dressing and then a dry dressing layer immediately above that. By doing so, a protective barrier is created to prevent the individual disturbing their skin's healing process, and the addition of the wet layer also acts in facilitating a moist environment that allows adequate hydration and a habitat suited for damaged skin repair. In the more common methods of treatment are not responded to, or patients elicit an intolerance, topical immunosuppressive agents may be prescribed. If a medical professional diagnoses an individual as having severe eczema that is unable to be treated by generic corticosteroids, or if they believe the side effects may be too severe, tacrolimus is usually prescribed. Likewise, sensitive areas of the body such as the face and neck can benefit from tacrolimus use as it possesses lesser skin thinning outcomes compared to corticosteroids, which prevents further skin loss in these vulnerable areas, allowing better healing and more positive outcomes for the patients overall.